Now again we are standing on the left side of the body, you can see, and we are doing the dissection of the axilla. This axilla is a pyramidal space. The axilla is the pyramidal space where the apex lies here. The apex is triangular, which lies anteriorly. In the apex lies the clavicle or the posterior border of the clavicle. Posteriorly lies the scapula, and medially lies the outer border of the first rib. This is the apex, and you see this hollow of the armpit forms the base. Alright, now this forms the anterior wall. This is the anterior wall, this is the posterior wall, this is the lateral wall, this is the medial wall, this is the axilla. Now coming to the anterior wall, anterior from outside to inwards, it is the skin with superficial fascia, as we can start to expose. Then this is the deep fascia. Then we have the pectoralis major muscle. Then we have the pectoralis minor muscle, clavipectoral fascia and subclavius. Above and below, it is the suspensory ligament of the axilla. Now this is the anterior wall. Then we have the lateral wall. The lateral wall is the bicipital groove, on either side of which is attached this is the insertion of the pectoralis major muscle, and there is the insertion of the, on this side we have the insertion of the latissimus dorsi. Now this was the lateral boundary. Now we have the medial boundary. The medial boundary again is formed by, if you can see from the side, the medial boundary is formed by the upper four upper four ribs with the intercostal spaces and muscles, and the serratus anterior muscle. You can see the serratus anterior and the nerve supplying the serratus anterior. This is the long thoracic nerve. See, clustered here. Alright, then if we go to the posterior wall, see, first we have to remove some of the contents we will show you, but before that you see all the lymph nodes and fat of the axilla, we are removing it. Now if you see the posterior walls, see, now if you go to the posterior wall, this is the subscapularis. Okay, this is the subscapularis muscle. Then we have,
this is the teres major muscle which becomes lateral. This is the thoracodorsal vessels and nerve.
Alright,
Teres major, and this is latissimus dorsi.
So this forms
posterior
the posterior wall. And of course the base is formed by the axillary fascia, which is attached on its upper aspect to the ligament of axilla. Of the axilla are, you can see the axillary vessels. This is the vein, axillary vein, this is the axillary artery, and we can see the cords of the brachial plexus with its branches, which we will deal with in details later. The long thoracic nerve, the thoracodorsal nerve, all the lymphatics and the axillary fat.